Glad to have you back. Still watching Arise News Day, actually, on Arise News. Well, the Physicians Week is an annual event of the Nigerian Medical Association, the NMA. It is usually a week-long activity in all the state branches of NMA. For more on this, we're now joined by Professor Dr. Innocent A. Ujah, President at Nigeria Medical Association. Can you enlighten us on what this week is all about?
Well, thank you very much. I'm delighted to be here. Just like you gave a summary, the Physicians Week is an annual event during which doctors reflect on their activities in the last 12 months and also reflect on the quality of healthcare that is being provided to our people. This year we've looked at, as you all know, this is not a normal year. We were greeted with COVID as early as February, COVID-19. And this clearly came when every country was unprepared. Particularly Nigeria was not prepared for the national response. But it came, and we had to confront it as doctors and other health workers. And of course, the government of Nigeria, we looked at the situation where all the health system collapsed, not only in Nigeria, but also in Europe and America. And we are lucky as a country, and probably as a continent of Africa, that we were not visited in this huge number where many of the people who were involved contracted the disease and many lives were lost. Yes, we lost some Nigerians and also doctors, particularly, and other health workers in the process of providing service to our people. And of course, we feel very sorry and feel very sad. In the process of providing health for our people, we had to lose some of our members. Very specifically, 321 doctors contracted the disease, 16 of them died. And this is part of the risks we face in obedience to the Hippocratic Oath. So we look at that and we felt that this year, Physicians Week should reflect on the work on the health system that we have in Nigeria, and we look at strengthening health systems in the era of COVID, and in fact post-COVID, because it's going to be a continuum. And that was what we started. Fortunately, we had a church service, and then on Monday we had the opening ceremony, during which we had high-profile policymakers participated. This year we decided to choose Lagos as the national event because Lagos is the epicenter of the disease. And we looked at what Lagos had done, and we see how we can look into the future. First, we must commend the governor and the government of Lagos State for confronting this hydra-headed monster, infection that was totally unprepared for, virus that was unknown. And the response, in our opinion, is satisfactory because we know that Lagos is a commercial nerve center of Nigeria, and therefore a lot of movements. However, we also feel very happy that the governor confronted it frontally with commitment, and we saw what the Commissioner of Health was doing with other workers, and then the commitment of doctors and other health workers to this, to the response to us is quite commendable. So what we decided to review this year with the health system, how do we strengthen the health system in the era of COVID? And this likely informed our decision to come to Lagos, being the epicenter of the COVID-19 that has afflicted the world.
And thank you for that. And how has the government responded so far in this pandemic? I know you were formerly the Director General of the Nigerian Institute of Medical Research, NIMA, a lot of people have said we haven't tested enough. As the president of the Nigerian Medical Association, you have said your members have been affected by this directly or indirectly. And you have also, unfortunately, lost 16 doctors in the country. Do you think we have done enough? What are we doing wrongly?
Well, first of all, whether we have done enough, that is one. Whether we have done anything wrongly, we have not done anything wrongly. What we have done is that we have not done things appropriately.
Okay.
I think that is that's the best way to analyze this. Let me just say that the federal government, that is the political commitment, was there. The federal government very quickly formed, constituted what we call the presidential task force and released some money. And also, we also found that the public sector came to the aid of the federal government. And we started, we thought we started very well, but we believe that we are not prepared. There's a difference between preparedness and response. If I equate this to what happened in 2014 with Ebola, before Ebola came to Nigeria, when I was DG of NIMA, we started a seminar series on the national response to Ebola.
Dr. Ujah, sorry, yes. I'm not trying to cut your apologies, but we're going to get back to you. We'll keep you on pause. We want to go to the governor of Lagos State, who is visiting areas that were vandalized or things destroyed. So we'll get back to you. We'll keep you on pause for now. All right. This is the governor still on his tour, City Hall. That's where Lagos Island, that's where he presently is, still touring the entire Lagos State. You can see him there with a cap, his hands on his hips, and then Ozzy, good. We're learning that this is City Mall, Lagos Island. Bring us up to speed.
City Hall is located on the Lagos Island and is adjacent St. Nicholas Hospital, the popular St. Nicholas Hospital. This Lagos City Hall has served so many purposes here. Is where people come to learn, especially those who attend both the institute classes. Here is located. There is a hall for different events happening here. This hall serves various purposes, and as it is, it has been destroyed, the glasses shattered, everything ransacked somehow.
Hello, Ozzy? We may have to look. Okay.
The governor is trying to ensure that everything here is accounted for. That's why we've gotten to this point. So, because probably it's due to the fact that the people that came to do this believe that the Lagos City Hall belongs to Lagos State government. That's why they decided to do this. The glass is all broken. Even the papers are destroyed. If you go in, you see a whole lot of scattered things all over the place. The books, the medium tax office of the Lagos Island, that's the Federal Inland Revenue Service. They also have an office here called Medium Tax Office, Lagos Island. That office too was vandalized. They went into the office,
all right,
destroyed.
Ozil, we're going to get back to you so you can share us the insights of the City Mall that you were just relaying events there for us. That was Ozzy, our correspondent at the City Mall, Lagos, where we witnessed quite some destruction. That was one of the places that, of course, the hoodlums went on rampage. We still have Professor Dr. Ujah there. I think you were on a line of thought. I'll allow you to continue. Doctor?
Yes, I was saying that the disease came where the whole world was not prepared, particularly Nigeria. And I also say that unlike 2014, when Ebola came, before Ebola came, we mapped the epidemiological characterization and the fact that Nigerians travel very widely. We started practicing and having seminars looking at issues of emergency operation centers and the rest. And when it came, fortunately, it came through Lagos, and Lagos stood very, very strongly, in its response. And with others, the federal government was also very well prepared. So why I'm going to history is the fact that people never knew that, or we were not aware that this will come to Nigeria. We know that we have some different SARS that came that were imported from China, but not COVID-19. So when it came, obviously the responses started, and we started monitoring. The Nigerian doctors, first of all, looked at the PTF and felt that the representation was not good enough because there were no scientists really that were there or doctors that were there. Those who were there were mainly politicians. We didn't have epidemiologists, we didn't have infectious disease specialists, but we didn't bother. We cooperated with government so that we can get over this pandemic. Unfortunately, as we continued, we found that it was increasingly becoming difficult for the country to cope. At the time, we had only about 2 or 3 PCR machines. But today, we are happy that the government had got up to 60 PCR machines to test for the virus. Even then, it's not enough, but it's better than 2 and 3. But we also found that the central coordination was not very effective because it's like going to war. And we thought that there must be commander-in-chief who will give orders that will be obeyed by all governors. Unfortunately, what we found was governors were allowed to do whatever they wanted to do. For instance, there are some states that say they didn't have COVID-19. We know they did, or they have, and they still have. But if the central coordination is not effective, then obviously the implementation will be faulty. We also realize that the testing was not as much as we expect. Nigeria is so large. We are supposed to have mapped Nigeria, just like Lagos mapped its state and found some cases coming from particular large number of cases coming from particular local government areas. Even within local government areas, we were able to map the specific areas that that were prevalent. So we didn't have that in Nigeria as a country. We believe that we needed to test more than what because and then we get results. Tomorrow we are told that maybe 300 people are tested positive. Next tomorrow is 150. But what is the denominator? We need to know how many people were tested before we can say the number that were positive, because we need to do the arithmetic of it and get the percentage. The percentage positivity would give us the trend and pattern of the disease, whether it is increasing exponentially, whether it is flattening. We do not have that luxury of knowledge and data. We don't have no luxury of data to be able to compare. So what we have is that, yes, we can say that Nigeria is responding. The doctors and other health workers are very committed. But what is, in our opinion, the minus here is that the central coordination is not as effective as we expect. And we think they can improve upon it.
Right, Doctor, you think you can improve on it. Let me straight ask you, then, if you think you can improve on it, what do you think should be done? And maybe, because this is a week-long affair, if I'm right, yes, it's week-long activity. So what other programs, in addition to what you think should be done, have you lined up for the Physicians' Week?
Well, actually, our week was very loaded. Unfortunately, because of what had happened with the NSAS presentation, we had to cut short. In fact, eventually, in obedience and in solidarity with those who lost their lives, we suspend many of the activities, because we planned that on Monday we were to visit the governor of the state, to interface with him and the State Executive Council, to see how far we can go, how we will make our suggestions and how we can improve on the testing, on the responses, and some of the complaints that arise in the process of the testing. For instance, the turnaround time was quite unusually long, and people had to wait days on end in suspense. So these were some of the things we thought we were going to do. Then on Tuesday was the opening ceremony, which was quite good. The First Lady of the state was there. I mean, gave us a good message and gave us hope. The Honorable Commissioner of Health, Professor Akin Abayomi, was in fact the keynote speaker and gave us excellent presentation and the overview of the activities of Lagos. We had thought that when we couldn't do that, we thought that that day or Wednesday, we were going to go to the isolation center to visit some of our colleagues that are there. We know that we will not be able to see the patients who are on admission because of the strict restriction of movements to the isolation center. But we thought we could see and give and encourage our colleagues, the doctors, and also other health workers, so that they can continue to show commitment in the face of unfavorable environment. But we couldn't do that. We also were to meet with the young doctors and interface with them because they have peculiar problems, just like the youth are on the streets protesting on NSAS and other factors that probably that have hindered their growth and development. The young doctors also have their own peculiar circumstances, peculiar complaints, and we thought we would interface with them so that we come to speak with them and see how we can address their own peculiar circumstances. Unfortunately, because of the NSAS protestation and the violence that erupted thereafter, we were unable to do that. So some of the activities have been suspended, some have been cancelled, but by and large, we will continue with some of these after the protestation. But we needed to suspend, particularly following what happened on the 20th of October.
And Professor Ujah, while we celebrate physicians all over the country this week and commend you for identifying with the young Nigerians who are calling for an end to police brutality through the End SARS campaign, you talked about the plight of young doctors. I wonder if you could just mention some and add to that the issue of industrial action in the healthcare sector. As the president of the NMA, what will be different this time around? And finally, as you are identifying with the NSAS protesters, we've heard some stories of those who were injured during this protest being turned back by hospitals. Why are we still seeing that trend of hospitals and doctors refusing to treat gunshot wounds by these protesters? What exactly is happening?
Well, let me just say that even before we started during the press briefing that we had on Monday, we said we are not celebrating, we are marking, because we couldn't be celebrating at the time when things have not gone haywire. We couldn't be celebrating where we're losing a large number of people to COVID, and then with the protests going on. So we said we are going to mark it as part of our activities for the year, but not celebrating. That is number one. Number two, the issue of young doctors, obviously it was there that they were going to tell us their problems. I wouldn't know what the problems are, but we thought that when we interface with them, then we would get to hear and then understand and discuss with them. The other one is the turning back of the alleged turning back of patients. I think that this cannot be verified and it's probably speculative because doctors are not supposed to turn out and turn back any patients. And that is why even with the risks we are facing with coronavirus, we still confront the disease frontally. So I think it's inappropriate without evidence to say that people are turning out patients. You know, there are all sorts of speculations, all sorts of things. I even know it was reported to me that some hospitals were attacked by the hoodlums. Not this time, I wouldn't say the protesters, but hoodlums took over the process, and you could see the outcome of what some of these things. Then finally, the issue of strike we talked about. Let me just say true that for the past 20 years, the Nigerian Medical Association has not gone on strike. We have not gone on strike because we think that we should develop a new strategy, a strategy of lobbying, strategy of constructive engagement, consultations, dialogue, and this is why NMA has not, as a body, has not gone on strike. However, the resident doctors who are affiliates of the Nigerian Medical Association for very peculiar circumstances had gone on strike, obviously. For instance, a situation where we are being confronted with COVID-19 and we would expect that there should be incentive, people should be encouraged to continue and to show commitment to the care of our people. And the basic thing that needed to be done, such as the provision of PPEs, the approved hazard allowance, were not even paid. We didn't have enough PPEs. I think that because not having PPEs is subjecting the doctors to increased risks of contracting the disease and dying in the process. I think that was what happened at the initial stage. And at the moment, I think things are better and they've gone back to work. We hope that the government will continue to accede to the needs because they are genuine. And because they are genuine, it will be nice, and we advise government to listen and intervene earlier than intervening only when strikes start. We don't want strike. We want to negotiate. We want to have successful negotiation. We want to have constructive engagement. I think if we do this, I can assure you that there will not be any. But if you look at that, even in some states now, in some states of the Federation, doctors are not being paid for upward of 12 to 16 months. I don't see where they will see commitment from these healthcare professionals, where they are working and they're not being paid. Where do they expect to get money to feed their families, to train their children? Or the children should be on the street. They should be out of school children because they are not being paid. I think that is very unkind of such governments, the state governments that are involved. That's unkind, that is unresponsive, and we do not want to accept such a situation.
All right, we'll leave it there. Dr. Innocent, or Professor Innocent Ujah, President, Nigerian Medical Association, thank you so much for your time on Newsday here in Arise News.